Hello everybody and welcome to The Daily Rinse. This is episode number 3 and I'm your host, Chris Barth. I've even got my fancy favorite fishing shirt on today to grab your attention. So the topic for today is dental implants versus natural teeth. And I just wanted to give you an opinion, my own opinion on the matter, and also disseminate some information so that maybe down the line, if you, your friends, family, have to make a decision, you have some more information at your fingertips. Natural teeth, bottom line, in my opinion, if you can keep them, save them. Dental implants are a great option. Both have great success rates, and this has been shown in the literature. There's evidence supporting keeping natural teeth for 20 to 25 years with good maintenance and oral hygiene, and there's also high success rates for dental implants, upwards of 97, 98% in certain populations. Of course, cleanliness and oral hygiene is again a factor in dental implants, and sometimes there's other factors involved like cost, location, the need for grafting, whether it be soft or hard tissue, but these are viable options. My bottom line opinion, like I said, on natural teeth is to keep them if you can. You can always get that dental implant down the road. And also, I wanted to remind you that dental implants don't last forever. They're not just a hunk of metal that goes in your mouth and stays there. They can fail. They can present complications. You can read more about this topic on an article that I wrote on medium.com. I'll post the link down below, and it presents a little bit more in-depth information on the topic, but I hope that was a little bit of a good teaser for you, and it kind of sparked your interest in that area. To conclude the episode today, I will be briefly discussing toothbrushing technique. So my whole stint on flossing last week on Instagram and Twitter is coming to an end. Not to say that you should stop flossing, but I wanted to quick go over some toothbrushing tips and techniques that you can use. Now, there actually are several technique names throughout the literature and the history of the articles that have specific movements and things to them. What I typically advise or give advice to people on is how much force to apply and the movement that you should be doing and the time that you should be spending there. So pressure, we don't want hard pressure. You know, growing up as a kid, I thought, I got to get in there and scrub all that plaque away as hard as I can, get it nice and squeaky clean. And that's not the case, actually. That can cause a lot of gingival recession, which can lead to very, very severe pain in some folks, especially when they're eating ice cream or drinking cold water or temperature changes of that nature. So pressure is a big thing. Like I said, too, the amount of time that you spend in your mouth brushing is greatly dependent on how much plaque. It's very dependent on how much plaque you can remove. And so if you spend a lot of time in one area, even with less pressure, you will tend to remove more plaque than if you scrub really hard for 10 seconds. So just a piece of advice, if you have trouble with pressure, a lot of folks hold their toothbrush like this, or if they're lefty, like this. Try holding it like a pencil, and that way your fingers are having trouble to produce a lot of pressure, and it actually ends up being a very nice way to feel the amount of pressure. This is, of course, for a manual toothbrush. There's folks that use electric toothbrushes. I'll cover that in another episode. Some of them are pretty cool. They have sensors to tell you if you're pushing too hard. But for a manual toothbrush, that's my advice. And the last thing was I going to talk about? It was pressure, time spent in the quadrant of your mouth, and the technique that you use. Back and forth, up and down, what angle. The way I tell folks most often, and what I recommend, is to hold the toothbrush, like I said, like a pencil. Angle it 45 degrees toward the gum line. If you're on the top, that would be up. If you're on the lower jaw, that would be down. Small circular motions as you move back and forth across the teeth. Don't forget to hit the tongue side of the lower teeth and in the front. It's a common place where folks have trouble removing plaque, even myself. And these are some tips I hope that can help you utilize your toothbrush more effectively. Like I said, check me out on the medium.com article on natural teeth versus implants. And stay tuned for another episode coming up shortly. And I hope you all stay clean and enjoy the rest of the weekend. Take care.